I'm Dr. Lauren Hunter. I'm a chiropractor and a qualified medical evaluator who serves as the Director of Rehabilitative Services for Boomerang Healthcare. So I think I kind of accidentally fell into the chronic pain space. I wasn't initially looking to that. I started actually working with athletes and then started working in a multidisciplinary clinic that specialized in chronic pain. And I enjoyed it so much that I continued my practice. The treatments or specialties that I think I'm most passionate about is the interdisciplinary approach. So I really enjoy working with various colleagues in the clinic because if I can't help you, there's somebody on site on my team that can. And so that collaborative approach I really think is the best course for chronic pain. One thing that I really think that sets Boomerang Healthcare apart and makes us unique is our multidisciplinary approach. So we have chiropractors, physical therapists, acupuncturists, and mental health providers that can work in unison to help you manage your condition. I think the most common misconception about pain management is that it's medication management only and that you're a victim of your circumstances. I think patients really underestimate the mind body connection and how much you can be an active participant in your care, doing home exercises, physical therapy, maintaining an anti inflammatory diet, and really working on your mental health and mindfulness to reduce the amount of pain that you experience. Patients don't realize that when you're experiencing anxiety or depression, your perception of pain is heightened versus somebody who isn't. So, really treating that whole person and that whole body is really important. So, the thing I find most rewarding about working with chronic pain patients is when they share with me their wins. So, if they're letting me know that their activities of daily living have improved, perhaps, they weren't able to pick up their grandchild and after getting some treatment, they can, or they've been able to return back to work, or after going through a functional restoration program, their outlook has changed, their anger has reduced, and now they've been able to restore interpersonal family relationships. I've, had patients that were on the brink of divorce and after the program, they've reconnected and, their relationships are better than ever. I would suggest that patients who are looking for chronic pain relief is, ask, friends, family, if they're involved in a community such as a church, if they have any experience with that, and if they have any doctors that they recommend. I think one of the best, compliments that you can get as a physician is a referral from a patient. So I think what makes Boomerang Healthcare unique is our functional restoration program and our other tertiary pain programs, such as the trauma recovery program, which is for patients who are suffering from post traumatic stress disorder, and our traumatic brain injury program for our patients who have suffered brain injuries as a result of their accidents or injuries. And a lot of other healthcare providers don't even have a multidisciplinary group and they don't have access to those programs. And I really think that that holistic approach for treating your chronic pain in a team is really what sets us apart.